Hi, welcome to Joint Effort Chiropractic. I'm Dr. Donath. This is my patient Zach. Zach is a bodybuilder. As you can see, he's a big, strong guy, and he came to me a couple months ago for an injury. And I'm gonna let Zach tell you a little bit about his experience so far, and then I'm gonna treat him.
So the funny thing is, I'm not a huge fan of chiropractors to start out, and you always hear all these things about how, oh, I went to this chiropractor once and they messed me up. So I'm always hesitant before I go to somebody, but I had hurt my back and I've been having lower back pain, like I'm sure most of you know, as I'm sure most of you probably have had in your lives. And the first thing he said to me when he came in is he goes, you know, so you compete in sports? I said, yes. And he goes, you don't look like a man that's going to quit. And I said to myself, he's right. Because the first thing that you're expecting when you come is that somebody's going to tell you to quit. Stop doing what you're doing. You're compressing your spine. Of course you have an L4, L5 disc. You're squatting over 500 pounds, deadlifting close to 600. You're doing all these things that are compressing your spine. So he goes, let's treat you. Give me 2 weeks, take off from training. Let me treat you, and then we can get you back so that you are effectively training and hopefully not hurting yourself even worse. And so he was really, really honest with me. And he also genuinely helped me get better, right? Both the rest, the ice, and the various techniques that he uses, twisting my hip this way, and and the anti-compressive exercises that he has me doing. All great stuff. So I've had a wonderful experience here too. So he really cares about his patients, and he really actually gives you the honest truth, and he does what's best for you.
All right, thank you. That's
welcome.
Really nice. I'll pay you later.
Yeah, that's right.
Before we started filming, I already did a few different moves on Zach, but
Just the basics.
But I'm going to start with his low back now. Okay, so Zach, just go on your side, face the windows, please. So when Zach comes in, I like to do a little ART, a little active release technique to his glutes and his piriformis and his psoas muscles. Okay, so we're going to start with that. We're going to start with the glutes. And slide, bend the knee first. Bend the knee, so a little more along the table. Then tuck.
Oh yeah.
Good. Okay. Go ahead. Good. A couple more like that, okay?
Customized care.
Okay, next we're going to bring this leg up, okay? So I'm going to be back in your back now, and you're going to kick this top leg out, keeping that slight bend in the knee as you go forward, okay?
Yep.
Go ahead. Forward for me. Good. No pain, right?
No.
Good. A couple more. Good. All right. The next move probably is the most important muscle treating any muscle in the low back is your psoas, the hip flexor. And so what I want you to do is I want you to kind of bring that top leg now behind you, backwards. Push, push, push. Most of us sit all day.
Definitely during these times, teaching remotely and everything.
Yeah.
I'm a teacher, by the way.
Good. All right, so now I'm going to adjust him. Okay, let's bring this shoulder up toward me. Get him on like that. Jam on, go around the table for me, if you don't mind. And bring that bottom hip up to me. Shift this. Yeah. No, too much. Too much.
Too much? Oh, I'm sorry.
Okay.
Oh yeah, I know what we're doing. Is that good?
Yeah, even if you tuck this in a little bit, a little better. Okay. Yeah, how'd that feel?
Felt that pop.
Yeah, good. Okay.
Excellent.
Take your time. Let's roll to the other side, please.
Also, he taught me very effective ways to get out of bed. Get out of bed on your side, people.
Okay.
Don't do a sit-up.
We'll show them that in a minute. Okay,
Oh, yeah.
Slide forward another inch or two for me. I'm going to tilt you away from me a little bit. All right, let's bend that knee along the table, and then bend, 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 tuck. Good, back up. Go ahead.
How's everything feeling?
A little tight.
Yeah. I've been inactive the last, I think, 4 days. I've taken like 5 there.
Just a little, nothing crazy, a little tight. Okay, let's go after that. Kick that top leg forward now. Great, back to neutral. Forward. Very nice. Okay. Stay there. We're going to do the psoas muscle again. And you go backwards.
Right.
Good. That's okay, Zach? push. Good.
I'm gonna hold for a few more seconds.
Remember that couple times? One time I did this with him, and his leg went back and almost knocked me over.
You go a little slower now.
Good.
You
That's
start to
good.
contract the glutes. The key with all of this, by the way, is always contract your glutes. Squeeze your butt.
Okay, let's lean back over here. Bring that bottom shifted toward me a little bit more. Good. Bend the knee a lot. Wow. There you go.
Oh, I feel this side. Oh,
There you
that was the one.
go. Okay, slide up towards me. Keep coming. You bend your knees. Yeah. Come further. There you go. Okay. So I'm just looking at his occipital now, looking at his scalenes. Well, nothing crazy going on. Check the upper traps.
Are they swole?
No, not crazy. That's pretty good. All right, so I'm going to adjust Zach's neck. He's got a spot right there.
All right.
So I'm going to start with the, since you're standing over there, I'm going to start with the right side first.
Oh,
Did it hurt?
no. Oh, good.
Okay. All right.
Mm-hmm.
Jamie, come on, go a second.
Oh,
I think they heard that down the hall.
I know. Probably because I'm sitting, I don't know if this has anything to do with it, but I sit in front of a computer now a lot more than I used to.
Yeah.
Because of the way I teach now. So I think I'm looking down. Maybe, I don't know.
Feels much better now. Let's
Right.
roll now onto your stomach, please. Take your time.
You gotta shift carefully. Lower back injury.
Okay, go fist down. Just put your phone aside. I don't want any pain, okay? Just doing a little soft traction here. Trying to separate the vertebrae a little bit. I'll feel something up here.
I did have a pain in my center back. I don't know. It wasn't severe, but it was definitely like.
Let's drop your hands to the floor for me, okay? Okay, we'll put a lot of pressure on you, okay? Just relax everything. Relax. That moved perfect.
Mm-hmm.
Okay, I'm gonna just use this machine on you. Too much or okay?
No, like, that feels good. I have one of these at home, so.
Okay, let's show our watchers how we get up properly.
All right.
So you go this way?
Oh, this way? Okay. So I'll show you guys. If you're laying on your stomach or back or anything like that, what you want to do is you want to get to your side. So you don't want to flex your spine too much this way. You can compress the facets that way. So what you want to do is you want to shift onto one side kind of carefully, not doing too much spinal flexion. You want to post your hand right over here. So you're going to push a little bit, shift your left hand underneath, right? Swing your legs over. And then get up that way with no spinal compression at all. So even when I was injured, or not injured, even when I was almost incapable of walking, I was able to actually do that without a problem. And I felt nothing bad in my spine at all. So really effective way to get up.
Okay, we're gonna do the Y strap now. We're gonna finish up with the Y strap. So come sit here. And one leg on the side.
key behind this is holding yourself in a stable position, and as he sort of decompresses the whole spine.
Let's go all the way back. Just fix your legs so they feel like you're stuck in the right spot. Okay. Okay. Put your head up for one moment.
This part always scares me.
Just relax. Alright, just try to relax everything. That's it. Easy as 1, 2, 3.
Yep, felt a little bit of a decompression of my neck, and I feel great now.
Alright, let's roll on your side to come up again. Okay, how do you feel? Why don't you...
Again, I came in here with some slight discomfort, slight pain level, and went from a 1 down to a 0. Now I have no pain. I'm completely comfortable, and I'm ready to get back at it. So Dr. Daneth, he always incorporates a lot of like you doing the work, right? As you're doing that work, he's also doing the work. So you're both basically working towards making you feel better. Sitting is a disease, and movement is the cure. So a lot of what Dr. Daneth does in here is have you move, and he moves with you. I immediately feel better, actually, right now. I didn't even know I had pain in my neck, and apparently I did.
Thank you very much for joining us, and I'll see you next time. Have a great one.